So usually I leave around 5:30, sometimes 6.
Thank you for calling Sanford. This is Teresa.
You know, the patients that are in more of a rural setting, well, I think it helps them be able to realize that I come from a similar situation to them, that I know kind of what they're going through, kind of their sacrifices that they make to get here.
The 17-year-old from Minot has spent the past 4 years being treated for common variable immunodeficiency, which makes her susceptible to infections and autoimmune diseases.
We had several patients in the state that already had pre-existing immunodeficiencies, some living very far away. So we thought it'd be great to have a clinic where everyone can come see all the specialists that they need to see at one time.
The nearest equivalent clinic is in Milwaukee, more than 500 miles away.
Good morning, Good Samaritan. This is Art.
He's logged 491 hours of service since October of 2023.
Operating the entry point,
Hey, Denny.
Art's favorite activity
Hello, my friend.
is what he calls
How are you this morning?
visiting the troops. A Korean and Vietnam War veteran himself,
What's your plans for today? Anything special?
he believes recognizing vets for their service makes a difference.
Being in the service, I know what the gentlemen are going through, and I went through it with them.
I have flown the ambulance planes to the four corners of the United States, bringing patients to specialties or bringing them home. I got to fly my own mom.
Selah, to this day, she loves this place. I can't imagine what her body and mind went through. But when she looks here, she loves it. She still calls this her castle.
We were able to work here in her twin home for as long as we needed to until she felt like she had the strength and stability that we had worked on to get over to our main building to work in our gym.
I never could drive my golf cart before this. I no longer just want to be pain-free. I want to learn how to walk like a normal person again, and I want to develop my strength. There's no stopping me at this point.
We've been constantly innovating and researching ways to improve hip arthroscopy surgery that is even more minimally invasive. This hip arthroscopy approach is being used to teach other surgeons throughout the United States and around the world.
There is a lot of peace of mind in walking in the clinic. They greet you by name. Jonah used to refer to the clinic as tap, tap, poke. But, you know, it was in a loving context. Like him and Jess, the lab tech, got along just fine. You know, it was only a piece of the broader spectrum of the care that he needed, but it was a huge resource for us to have to be able to just save so much time.
The Titus family used to travel 6 hours round trip to Rapid City, South Dakota. Now they're just an hour away from the clinic in Dickinson.
This is why we're so passionate about closing gaps in rural healthcare.
We intentionally made it very flexible so that we can change and evolve and grow just to be able to serve our patients in rural America better. Virtual reality lab and the simulation space and the ability for us to record and play back, I think will be very interesting with some new technologies and simulation in that space. We have a patient and family experience lab in which we'll be able to bring patients in to test out new solutions that we may be developing in what would give them that seamless patient experience using our digital tools.
And trying to continue to determine how and when we can be the premier education and training center for clinicians within the United States as well.
In 2025 is, I think, it was when we transitioned from hype to help. There's been lots of hype over AI, lots of help over virtual care, but we're now figuring out how to operationalize these things. So in 2025, it's going to bring healthcare into people's living rooms. It's what's going to be expected for high quality, high value care at Sanford.
I feel like at 60, it's the new 30 for me.
Still ascending, Hodel and his son Nicholas summited Mount Baker in Washington State this August.
I think a lot of people just give up, and they shouldn't. I'm not going to spend my days worrying about getting older, about a simple knee injury. I'm going to slide into home base on my very last days.